everyone, welcome back to the Texas THC Doctor YouTube channel. My name is Emily and I'm here with Dr. Shah today.
Hey guys, how are you guys doing?
Good. So today we are going to be going over something I actually ran into because it hits close to home. I know a couple people with this syndrome. It's called Cannabinoid Hyperemesis Syndrome. It was something me and Dr. Shah had talked about like a week ago, and I kind of just did a deep dive into basically what it is about and everything around it. And yeah.
Excellent. Yeah. So it was a really interesting syndrome. I came across it when I was living in Colorado. I was a doctor up in a place called Fort Collins, a beautiful town. And while I was at the hospital, we would get young people coming in with persistent nausea, vomiting, and they could not stop vomiting. They felt nauseous all the time. They couldn't keep any food down. And, you know, that being something that we don't see that often in young people. You see it in pregnancy, you see it in certain diseases, but in young healthy people, you don't expect to see that. After learning about it, because living in New York and training in New York, we don't come across it that often. But it was diagnosed as something called Cannabinoid Hyperemesis Syndrome. Basically, persistent nausea throughout the day. You can't keep any food down. You told me that you had someone that you know that actually had something similar to that. Do you remember their symptoms?
Yeah, so actually I've had a couple friends growing up actually, and then a couple friends now who we didn't know about it. Now we do. It's been more like talked about recently, especially with like legalization and stuff like that in other states and more studies over it. But before, it wasn't really talked about, and I had friends who would get really nauseous or wake up and throw up every morning and stuff like that, and we didn't know what it was. We referred to it as like greening out. So they thought it was just like, oh, like I just did too much this one time, but then symptoms kept persisting and stuff like that.
Exactly. And
this is what it is. And a lot of the people that I do know that have it are in denial about having it too. Like they're scared that they have it.
You know, it's something, it happens to people that are long-term users. It almost never happens to people that have tried it once or twice. It's someone that uses it almost on an everyday basis or pretty regularly. It happens more so with young people. They're the ones that tend to use it more on a regular basis. But the symptoms can be pretty intense, especially when you have to get admitted to the hospital because you can't stop vomiting and you can't keep any food down. So it can become an emergency at that point because you can get severely dehydrated. And if you lose electrolytes, it can cause issues with your heart. So, you know, you can have seizures. So a lot of bad things can happen. Although rare, it can cause a lot of problems. So most people have to be admitted for a day or two. Have to refrain from smoking, obviously, during that time, and the symptoms usually go away. But if they start smoking again, it almost comes back almost immediately.
Yeah, especially nowadays too, because we had mentioned in previous videos, THC in weed itself has actually grown in potency. So what used to be, what was it, like maybe 6%?
Yeah,
THC?
5 to 6%.
Now is like,
oh, in some instances, it could be almost 90% stronger than it was previously. Those are the extracted forms, but in terms of the smokable forms, almost like, I think it's like 35 to 40% stronger than what it used to be. So a lot stronger.
Stronger.
But you wanted to talk about basically what else it entails, the different symptoms involved?
Yeah, so basically, the symptoms that are involved are abdominal pain, the nausea, the vomiting, and then the vomiting will lead to dehydration if it gets really bad. These symptoms can be mistaken in some cases for an eating disorder or anorexia or anything like that if you aren't aware of CHS. Like I've heard or I read different cases where they thought it was anorexia or an eating disorder because it was like, oh, well, you're throwing up a lot, it might be this or that, but it actually turned out to be CHS because they were smoking pretty regularly. People who reported to have it actually smoked at least 20 days out of the month, 3 to 5 times a day.
Well, for some people, yeah, I mean, but some people are using it medicinally and they are using it every day. The symptoms usually aren't present for most people. It's more of a younger generation, continued use, but we have a lot of people that smoke on a regular basis and don't have these symptoms. So, you know, a lot of people ask, why does it happen to some people versus not happening to other people? We really don't know. That's the easy answer. We really don't know exactly why some people get it and some people don't. My personal thought is that it's because they have really strong THC strains that don't have a mixed blend, and I think the mixed blends will have less chance of that happening. Now, let me explain why. You know, people are probably on the other side saying, no, that's crazy. That shouldn't be the reason why. The mixed blends that are closer to like more hybrids, I believe that because they have CBD and THC, the entourage effect would help prevent that from happening. You know, the THC affects your brain more, the CNS system. And it's actually supposed to cause anti-nausea or antiemetic effect. So why does it make us want to vomit when it's supposed to be the opposite? The thing is, THC has the opposite effect on our gut. It can actually make us have a slower emptying time or gastric emptying, and that can lead to symptoms similar to having nausea. But when you have CBD, that actually would be the calming effect on the gut and not cause that. So I think a mixed blend with some CBD would actually prevent this from happening. So, I mean, I guess you can research it at home. If you're having these symptoms and you still want to continue smoking, obviously you have to stop smoking for at least 2-3 days. But getting a different blend that's more higher in CBD and less in THC might actually be beneficial. Let me know if that works. This is purely a guess. But scientifically, I think it would make sense if you would get a blend that's a little bit more of a hybrid and had a little bit more CBD than THC.
And in the research I did, I actually did see a study where they are trying to use CBD to combat those things as well. It actually is being researched right now.
It makes a lot of sense, right? It would make sense that way, that if you have the entourage effect, it would actually help prevent some of the adverse effects of it. But going back to the phases, it has a prodromal phase, which is more accompanied by things like abdominal pain, bloating. That can last anywhere from months to years for some people, where they just feel like, oh, I'm a little nauseous, so they'll smoke some more in the morning and they'll feel better and they think that's it. But then it can advance into the active phase, which is the hyperemesis, which nausea, vomiting, inability to keep food down, and a weird symptom. This is pretty interesting. I think I asked you if your friends had this happening. People who have hyperemesis, one of the symptoms they have is they want to take hot showers, like really, really hot showers. And I noticed this in the hospital because I've never seen someone walk into a hospital and ask for a shower. So it would be, they would come into the hospital, they get admitted, first thing they're in the shower taking a into the bathroom and taking a hot shower. And then they'd continue doing that like almost every hour on the hour. You know, the hypothalamus is our temperature regulator in our brain. So we feel that that hot temperature somehow soothes the brain and causes a relaxation. They've tried things like capsaicin cream and rubbing it on the belly, because that would affect also heat temperature relationship and then cause some relaxation as well. But ultimately you have to stop smoking for at least 2 days. Go to the hospital if you have persistent nausea and vomiting, because you don't want to get dehydrated. Like we said, it can lead to a lot of bad things, and dehydration can lead to seizures. It'll lead to your body shutting down, electrolyte abnormalities, arrhythmias. So go to the hospital, get your IVs with fluids and your electrolytes so that it doesn't reach that point if you are persistently vomiting.
Yeah, going back to what you said about like the hot showers and stuff like that, it is so common for people to do those things, like run to the shower or use heating pads as well on the abdomen to help that. I did see as well on all the studies that I like researched about the capsaicin-based creams and stuff like that that they're using, and that's very recommended as well if you do start to feel these symptoms at home, like anything from like, what is it, like Bengay,
Icy Hot, all of those that have that that capsaicin essentially is a pepper, and it can cause that slight burning sensation, but it also causes increased heat to be formed. But yeah, that's definitely useful. But the best thing, honestly, hydrate, stop smoking for a day or two, let your system get back to normal, and then if you are going to continue smoking, try to change what you're smoking into a higher CBD portion, and see if that helps. If it doesn't, I'm sorry, I don't know, but at least we can try it and see if it's something that could help. You know, it is scary for those that get it, so you know, hopefully we're educating some people on it and explaining to them what's going on. That being said, I also want to say, if you have abdominal pain, nausea, go to the doctor and it's not going away, don't think it's just this. Go to your doctor, ask your doctor. It could be something else. I mean, there's a lot of other diagnoses that are very similar to this. You know, you can have appendicitis, you can have gallstones, God forbid. There's a lot of other diagnoses that could be related to this. You could be pregnant.
Yeah.
You know, so there's a lot of options in terms of what the diagnosis could be based on those symptoms, because they're pretty consistent with a lot of different diagnoses.
Exactly.
But hopefully we answered some questions for people out there and explained this really unique syndrome that not people aren't familiar with, and hopefully we can, you know, help guide you. If you have any questions, any new questions that we have, please let us know. I think next week we're going to try to talk to our medical assistants at Texas THC Doctor, since they deal with so many patients there and they have a lot of feedback from the patients. We can communicate with them and ask them what different questions that arise, their encounters with different diagnoses. I think one of the cool things that we might go into is autism. We have a lot of success with autism. Parents are so happy that they now have another medication in their arsenal to use, and providing a lot of benefit for them and improvement in quality of life for their families. Well, that's it.
Awesome. Okay, if y'all have any questions or comments, leave them in the comment section below. Follow us on Instagram and Facebook. We are at Texas THC Doctor, and visit our website for any information you want to learn. It's www.texasthcdoctor.com.
And the phone number is 830-549-5500. Again, that's 830-549-5500. You can just talk to a real person and we can answer all your questions there as well. Take care, guys. Merry Christmas.